Hello from a snowy Toronto. My name is Kevin O'Keefe, and welcome to ChiHi's webinar series, Beyond the Numbers. So I decided to start my new year with a clean slate. I have a confession. Before the holidays, I was having some abdominal pain. My doctor ordered an ultrasound, and a few days later, I received an email with the images attached. Instead of waiting and worrying for a week to get the results from my doctor, I just uploaded them to ChatGPT, and within seconds, it diagnosed me with a hernia. A week later, my doctor confirmed it. But I'm pretty sure I'm not the first person to use AI for health-related questions. In fact, OpenAI recently announced ChatGPT Health, a dedicated experience designed for health and wellness, because they said 230 million people each week ask ChatGPT Health questions. In a moment, you'll meet our panelists who will talk about how they're currently using artificial intelligence to improve Canada's healthcare systems safely and securely. But first, a quick shout out to the over 1,000 people who registered for today's webinar, zooming in from right across Canada, including Newfoundland Health Services, the University of Calgary, Saskatchewan Health Authority, and Windsor Regional Hospital. Now, on to some housekeeping. All webinars are available in both English and French.
Pour écouter l'épisode en français, cliquez sur l'icône en forme de globe. Si vous ne le voyez pas, cliquez sur plus.
As well, closed captions are available by selecting the Show Caption button at the bottom of your screen. This webinar is being recorded and will be available on the Beyond the Numbers page on chihi.ca, as well as in a follow-up email you'll be getting in a couple days. We'd really like this webinar to be as interactive as possible. There are a number of ways to ask a question. Some of you wrote one when you registered, which we'll be asking throughout today's session. You can also type a question in the Q&A button at the bottom of your screen. My colleague Angela from ChiHi is standing by and will be reading off your questions. You can also ask a question live. When you joined today, you were automatically muted, but just click Raise Hand at the bottom of your screen, and when I call your name, you will be asked to unmute. Don't worry, your camera will stay off, and asking a question like this is the easiest way to get it answered quickly. Before we begin, we acknowledge and respect the land on which ChiHi offices are located. In Ottawa, it's the traditional unceded territory of the Algonquin Nation. The Toronto office is located on the traditional territories of the Wendat, the Anishinaabe Nation, the Haudenosaunee Confederacy, and the treaty lands and territory of the Mississaugas of the Credit. We acknowledge with respect the traditional territory of the Kanien'kehá:ka, where our Montreal office is located. In Victoria, we acknowledge with respect the traditional territory of the Songhees, Esquimalt, and Wasanich peoples, whose historic relationship with the land continue to this day. We recognize that these lands are home to many diverse First Nations, Inuit, and Métis peoples, and we embrace the opportunity to work more closely together. Now everyone can feel free to acknowledge the land you are zooming in from in your own way. Just before you meet our panelists, it would be helpful for us to get a sense of how much you currently use artificial intelligence. So if you could please take a second to answer our poll. I use it every day, a few times a week, a couple times a month. I currently don't use it at all. Now, I'm going to ask each panelist to briefly introduce themselves and talk a bit about what they'll be sharing at today's webinar. I'll start with you, Robert.
My name is Robert Greer. I am the technical director of the Sick Kids AI service at the Hospital for Sick Children in Toronto. Additionally, I co-lead the Lawson Labs Research Group, which is a multinational research consortium focused on medical device data and how we can use it to predict what's going to happen with patients in the next minutes to seconds. Additionally, I'm the co-founder of 3Lead Analytics, which is a startup in the physiological data space, commercializing technology Atrium DB that was built at Sick Kids and bringing it to the world to hopefully revolutionize healthcare. Thanks.
Excellent. Thank you for joining us. And we have another Kevin here today. Kevin Dick, go ahead, introduce yourself.
Yeah, thank you so much for the opportunity to speak to this. I would say I don't not only use every day, but I would say I develop every day. So I come in with a lot of expertise really on the foundations of AI modeling. I'm the AI data scientist at Bourne, Ontario. I'm also cross-appointed at the Children's Hospital of Eastern Ontario Research Institute, CHORI. And so I completed my PhD in 2022. Prior to that, I just had grown up with a strong interest in how we can automate the world, how machine intelligence can serve to leverage this wealth of data for various purposes. And so my PhD in large part was focused on rare event detection in the bioinformatics space. I went on to do my postdoctoral research work on autism spectrum disorder, really integrating the wealth of health data that we have in Canada. And I'm excited to speak to many of the different applications and ongoing work towards a great vision of how we can use AI in healthcare.
Fabulous. Azra, can you go ahead and tell us a bit about yourself?
Hi, good afternoon, everybody. My name is Azra Dalla. I'm the Director of Health AI Implementation at Vector. So my answer, being from a research institute, is that I use AI every day. Vector is an independent not-for-profit research institute that was established as part of the Canadian AI strategy. And so we work with Canadian industry and public institutions to really develop the people skills and resources to be best in class in AI. And in terms of my portfolio in particular in health, we focus on driving the adoption of AI solutions within health systems. And so we work with various partners, be it public health agencies, hospitals, SMEs, to really advance and scale AI across the health system. And while my work focuses on the development and deployment of solutions, one important and really fundamental piece to AI is ensuring that it's safe and trustworthy. So I'm going to touch upon that today.
Terrific. And last but certainly not least, Alvina, can you tell us a bit about yourself?
Yes, hi everyone. Really nice to be here. Hopefully the storm keeps our lights on and cameras on.
Absolutely.
I'm coming in from Montreal, and the question, how often do I use AI? Every day, whether it's my personal life, but also a lot for work as well. I'm coming in today with a few hats. So my background is in engineering, and I'm now a consultant in human systems centered design, as well as change management when it comes to whether it's people-centered systems or technology, whatever it may be. Everything's about people, really, if you think about it. And I'm also coming in as someone with lived experience with cancer and using AI to help me navigate it. I'll get into that a bit later.
Terrific. So now that you are familiar with who we are, let's see how familiar you are with using artificial intelligence. We have over 500 people here right now. It used to give me percentages, but now it's giving me numbers. 214 use AI every day. 156 of the 500 or so use it a few times a week. About 100 use it a couple times a month, and 50 don't use it at all. So it's quite interesting, even when you think where we were 6 months ago, a year ago, et cetera, how easily over 2/3 of the people here use it every day or a few times a week. So it's out there and it's growing. And Alvina, I just want to quickly segue to what you said. I'm really, really, really glad you're here today. Not only because your story is fascinating, but I heard you say before that the key to AI success in healthcare is the involvement of patients. Not at the end, when the technology is almost finished, but at the beginning, so they can become co-creators. So in that spirit, can you kick things off today with your story?
Yeah, so the start of my story really was, I would say, well, now I think back, it was probably 2022. But to understand my story, you have to understand a little bit of how I was navigating what were actually ovarian cancer symptoms at the time. So I was 36, 2023, 2 kids, there were 3 and 6. I was working as a change management consultant in the technology space. So I was familiar with tech, and I'm very much a technology enthusiast, and kind of like what Kevin said earlier, wanting to understand how we can do things better and faster, but really, the impact technology can have in a positive way. And so I just was fascinated when AI came out in November of 2022 when ChatGPT became available. And because of my work, we were kind of using it as well. So it was just natural for me to test it and but always in a work context. And if you remember in those early days, we were using it to, write emails better and kind of helping us tune our words a little bit and make this sound more strategic, or we were kind of brainstorming a lot with it, right? So, and that's how I was using it as well. But then in January, February, I started to feel a little bit unusual, not like myself. I started to feel fatigue. I started to feel things just a bit off, not my usual self. And so instead of Googling, I wondered, well, I have been using this tool. And so I wonder what that experience would be like if I were to just ask a question that was more health specific, which I had never done before. And so I had to, curate it and ask it intelligently and kind of model it. And I was just like, I didn't say it was me. I said, imagine we're doing this role play. Imagine you're a resident and a patient walks in, 36-year-old female. Here's some context on her life. Here's what she's feeling. What are your, how would you proceed? Like, what would you do? So I just went in with curiosity, not asking it to confirm or deny something I was saying, but truly with curiosity. And so that kind of led to me noticing more symptoms like bloating and menstrual cramps that I wasn't used to having. And so just being in tune with my body, but then putting that information somewhere intelligently. And because it was able to build history throughout the chat, it was able to eventually kind of connect the dots together and build that constellation. So, you won't know what the Big Dipper is until someone says, if you connect these stars together, it makes the Big Dipper. So it kind of did that for me. And so it led me to go get checked. And not just that, but to go and ask my doctor and present the right symptoms. So that's kind of the way I was using it. I was saying like, okay, well, what are the symptoms I need to be presenting to my doctor together? Because if I brought them each in isolation, it might not have led to a diagnosis. So that's kind of how it started. And then, it led me to really an interesting place because it was still AI, and it at one point did mention cancer, but I wasn't looking for cancer. I was just curious about what this could be. And so at one point, I decided to ask a human, my cousin, who was older to me. And I said, hey, I'm going through this and I'm feeling bloated and it hurts. I don't feel like myself. And her response was, well, welcome to being a 30-something-year-old, like this is womanhood, maybe it's perimenopause. And so it's interesting because in that moment, I had this history of this dialogue I was having with this AI tool and then this human conversation. And in that instant, I was like, wow, without hesitation, what happened here was my cousin's lived experience cast a shadow on what I was explaining to her. Whereas I had this tool that didn't have its own personal history, right? So, and just that contrast made me go, no, I should take this seriously. Maybe it's nothing, but I think I should go get it checked. And literally the next day I went and immediately was sent for testing, and the process went really fast. And throughout that journey, I used it really as, I like to call it like a thinking partner, where I knew enough to say, hey, I need to remind myself this isn't magic. This is not a person. It's a machine that has learned a lot of information. It can make mistakes as well. So keeping that in mind, approaching it with curiosity and structure and knowing that I need to stay in the driver's seat, that really helped me because, for example, between the moment I had the oncology appointment and, the first appointment that I had my doctor, those are the most anxiety-riddled moments. Even if it lasts a week or two, it's just, you don't know what to do, right? Your life is being handed over to a specialist that you've never met. You don't know who they are, how they will perceive you, and how you'll perceive them. And so that's when I also use AI as a tool to be like, okay, well, here's what's happened. Here's my scan results. Explain them to me, but then I can't validate that. So based on what you just explained, what question should I be asking my oncologist when I first meet them? So it really served as a tool that I kept coming back to in different ways, whether it was to help me then manage my chemo side effects, or how to tell my kids that, their mom has cancer. Do I need to use the word cancer? How do I explain to a 3-year-old and 6-year-old what's going on? And then mommy's going to lose her hair. So all of that, it really served as a navigation tool, as a thinking partner. So yeah, and then so that kind of pushed me into thinking like, wow, like the work I was doing when it comes to change management and human-centered design, really not in the healthcare space at all. It just pushed me to say, I need to find a way to take that methodology that we use for other things in all kinds of industry, car manufacturing, anything that you think has a process, it's being used. Your phone, for example, think about it. And how do we bring that human-centered approach in healthcare systems? And when you look at it, it has to start with the end users in mind. And for me, that's patients and providers. It's anyone interacting with the system, really, right? So it's anyone who's touching the system that we've built together collectively. Not one person has built it alone, right? So I think that's important. And so integrating those feedback loops is super important. That's how you get to good design. And just good design, initial like design, what's the word I'm looking for? Like statements. Like, what are we designing? Who are we designing? What purpose? And what's the human experience? And if you think of human systems, you're trying to get from a poor human experience to a better human experience, right? And that's the real outcome. So if you're missing out talking about experience in what you're designing, then you're missing like the whole point of a human system. So that's kind of the work I'm doing now to really bring that lens of human systems and patient advocates. Patients, I'm telling you right now, if you were to go on LinkedIn and ask the question, specifically asking, if you're a patient, write me a message. If you use AI, you'll be bombarded because a lot of people were using it. We just weren't comfortable sharing it because it was like, oh, I'm going to get judged. But there's a whole community of patients who are using AI way before the health system even maybe thought about it. So yeah, I'll stop there and let things.
Oh, thank you. Yeah, thank you so much for sharing that very personal story. And I'm also comforted that I have a fellow chat GPTer who searches there for health-related questions. I know, Angela, you said, and I'm seeing, I want to say 1,000 hearts go up while you speak. So clearly what you're saying is really resonating with people. It's also, a couple of people have a few questions. Angela, do you want to jump in?
Thanks, Kevin. Yes, Alvina, someone commented that they use ChatGPT to help explain their blood test results and that it's always been 100% accurate and extremely helpful. And then somebody has a question. They want to know what advice you would give to someone who's about to go to their doctor on how they can use tools like ChatGPT.
Good question.
In terms of sharing that they used AI?
Or I think using AI to ask, like, how can they use AI to be a better patient, I think is what they're getting at.
Right. So I think it's again, like remembering that it's a machine that has learned a lot of information, but it's also a machine that's learning how you talk to it. So if you remember these two things, the way to stay in control of it is to be open and remember, what is your objective? Your objective is to come up with questions that you want to ask your doctor, or is your objective to convince yourself that you have this disease that you think you might have? So if you have that clarity, then you will ask open-ended questions, right? You won't say, is this cancer? You'll say,
right,
what are the underlying causes or possible underlying causes that are most likely? What questions should I ask my doctor? Given this history, what are, so those are the kind of, you have to come in with that approach of just purely from curiosity and wanting to learn from it rather than wanting it to confirm that you have something or don't have something. So I think if you take that approach, it's safer because it will maybe try to people please you, and that mode will engage. And that's where we get into kind of riskier territory.
I think that's really solid advice. And I was thinking about, and I will do a quick plug now because Alvina and I met before. You actually did a podcast with us and it was just posted a couple days ago. So if you want to hear more about her story and her work with AI, it's on all streaming platforms. And I'm going to have a QR code at the very end of today's webinar with a link to that episode. So be sure to listen. So that's just some of the benefits of AI for one patient. Robert, I wonder if we could go to you now and talk a bit about how SickKids is using AI to benefit patients at your hospital.
First, to start off, Alvina, thank you for being here. The patient stories are, well, let me rephrase. As a software engineer by training, the reason I went into healthcare is to create these stories. There is no other discipline in software engineering, in my case, or no other industry to work in where you can really see the impact of the work that you do. And when I get out of bed every morning, this is what drives me. This is creating these stories. And that's why I've chosen AI as the world to focus on. So hello again, everyone. I'm, as I mentioned in my introduction, I'm the technical director of the SickKids AI service. At SickKids, we are, as part of our 2030 vision, we are laser focused on diagnosing faster, treating smarter, and predicting better. And one of the key enablers of that at SickKids is the use of AI. And we're not an organization that is just using AI in small components here and there. We see AI as a technology that's going to revolutionize the way not only that we deliver care across the hospital, but also the way that we can improve our business and how we operate as a healthcare organization. So understanding that we needed to really embrace AI and do it in a safe and responsible way. In March of this past year, we launched SickKids AI, which is our trailblazing AI program that is going to impact, will revolutionize pediatric care, education, research, and operations through responsible AI. The SickKids AI program itself is made up of 3 components. First, the SickKids AI service, of which I'm the technical director. We do everything from create AI literacy materials for both families and for our staff members. We also, my technical team develops AI solutions from concept through deployed solution. We also work with our AI innovators in our research institute to help take the amazing innovations that they're creating every single day and operationalize them to the point of impact so that the research that they're doing is able to make impact on the patients that they have. Additionally to the service, we have our Sky Discovery wing, which is a constellation of AI researchers that are united to redefine barriers and generate amazing new knowledge. And these are all weaved together through the fabric of the Sky community, which we've created to break down the barriers, if you will, between classic hospital operations and researcher, and really weave everybody together and have them focused on and collaborating on driving the next set of innovations. And through Sky, we're really going to drive impact across the organization, not just in health, but drive sustainability of AI through business development and commercialization of the AI work that we've done, and ultimately improve the organization and the care we provide as a whole. And this is most importantly built on a foundation, first and foremost, of patient, family, and staff engagement. We involve families, patients, and particularly including staff across everything that we do. We've built a foundation of AI literacy across the organization that continues to develop. We have great data and technology to enable us to scale with these, and change management to make sure that the solutions that we build are deployed the most appropriate way and being monitored to ensure that they're having the impact that they're meant to. I myself, as I mentioned, work for the SickKids AI service. Behind that is an amazing and motivated management committee. Our AI management committee is comprised of leaders from across our organization that provide a wide variety of skill sets that can be tapped into by AI innovators at any stage of the development process, and are also engaged to do things like create policies for the organization around AI. We also approve all AI solutions that are going to impact clinical care or hospital operations. So as you can see, a wide variety of very senior people at SickKids, but to explain how motivated everybody is and how engaged they are with AI, this group meets every 2 weeks for 2 hours. So quite a commitment, and the impact is already being seen. We already have or are deploying AI solutions across all facets of hospital care, clinical care, and hospital operations, from our emergency department, where we're deploying a custom wait time predictor that will allow patients to scan a QR code when they go through triage and get a personalized wait time down to the minute for how long they'll have to wait for care. Or in that same period of time, preemptively order tests that would otherwise require them to wait to see a clinician, having those tests ordered automatically to speed up the time to care. On our operations side, we've rolled out our Ask HR chatbot, which allows staff to interact and ask HR type questions without the need of going through a slow email process. And in our critical care department, area near and dear to my heart, we're doing things like predicting which patients are going to deteriorate in the next 1 to 2 minutes, or the next, and additionally, patients that are going to enter critical arrhythmias, all happening in real time with alerts delivered to the care team. So all across the hospital, as you can see, much AI is happening. And just a quick shameless plug to the work that I've done. This is a snapshot of the environment that I work in, critical care. I mentioned in my introduction that I co-lead a research group that is focused on leveraging the millisecond to millisecond insights that the vast array of medical devices that our critically ill patients are connected to can generate. So with that, our group is more of a systems engineering group. We built a platform called Atrium DB that allows us to not only capture and store vendor agnostic medical device data, but to take that data and really rapidly develop and, most importantly, deploy machine learning solutions on that. And that platform is now deployed at 10 hospitals around the world, 15 models developed, and 3 of them deployed at multiple sites. So taking sick kids innovation and Canadian innovation really and showing its impact across the world.
Extremely impressed. I don't know how else to summarize that. Wow. I've seen tons of thumbs, tons of hearts, and tons of questions come in as you were talking. I'm going to go to you, Angela. I know you have a couple questions standing by. Can you just give us a question or two?
A specific question for you, Robert. What AI governance activities do you recommend at the runtime level?
This is I could be very long-winded here. I would say reach out if you want the independently, if you want the full answer. I will say that I'll give you a highlight of one specific area that's top of mind these days, and that's monitoring of AI solutions after they're deployed. So AI solutions, not everybody realizes they're very much living and breathing things. They're subject to the data that they get in, which can change, and depending on the AI solution itself, it itself can change. So not a lot of people realize that in order to ensure that an AI solution is safe and working properly, you don't have to just test. You don't just test it at the beginning. You have to continuously evolve it. Or continuously monitor it for evolution as it goes. So one of the approaches that we've taken at Sick Kids is through centralized monitoring. So we capture monitoring telemetry data, everything from on the technical side, that servers are working properly, to model performance, but also looking at the human side of things. So is it actually having the desired impact clinically, for example? We bring in all of that information into a central place where we can through automation, because it's a huge amount of data, can alert, can dashboard things, can generate alerts, things like that. So I hope that it scratches the surface on your question. There's a lot to it.
Yeah, some of these questions are very complex. I appreciate your summary. And speaking of time, we're about halfway through the webinar. We have 2 more panelists, and I see lots of questions and raised hands. But I really want to go to Kevin first. And here's another shameless plug. This is how we first met. When we interviewed one of your colleagues at a project you were working on that's using AI to predict the risk of autism in babies. So Kevin, can you share a bit more about your work with artificial intelligence?
Yes, absolutely. Thank you so much for the opportunity to speak to this work. It's wonderful that ChiHi is putting these initiatives together. I think patient and clinician and research domain expertise and education around AI is important. We see so many diverse ways that it's being used that Alvina highlighted. And of course, Robert, you show what Sick Kids is doing. From my perspective, I'm really excited to share basically where AI at Born Ontario and CHIO-RI is going. There's a lot of it, I would say, similar fusion of interests and directions with what Sick Kids is doing as well. So with that, I just want to introduce briefly what the Better Outcomes Research and Network Born Ontario is. It's essentially a province-wide registry for pregnancy, newborn, and child health data. Really, they're mandated to collect vital information, all with this underlying goal to improve maternal-child care, whether that be through epidemiological studies or guiding health policy. Really, the underlying goal is we want to build a system that will ideally support mothers and their children into the future. And the exciting part is, as an organization, it holds over 1.9 million records that can be linked across all pregnancies in Ontario, going as far back as 2012. Having very much had all my education in the more software and AI side of things, I was very excited that, for most AI systems, there's a wealth of data is needed to really develop large-scale systems. And so this is a really excellent opportunity to try and take this data and really operate at scale, really for the goal of population-level health screening. And so Born Ontario itself is mandated through Prenatal Screening Ontario, or PSO. It has this oversight role, but there's also this vision towards the future, and I think it relates in some ways to what Sick Kids is doing and what Robert highlights, this idea of being able to develop systems locally, but then also have them operate almost nationally and internationally. And Born Ontario currently is working towards developing a digital and interoperable perinatal record for Ontario, but that potentially could be used in other jurisdictions. My own shameless plug is I lead an embedded AI foundations research lab. And so much of my interest is on the development of AI methodologies, but really thereafter applying them to developing these next generation population level screening algorithms. I do want to acknowledge my postdoctoral research supervisor, Dr. Christine Armour here. We've been working together for a number of years, and through funding that we've sought together, we've been able to really establish this work. The other thing I want to highlight that Sick Kids is doing, that on the GORI side we're doing as well, is really this idea of trying to lead ethically and responsibly. AI is a field that is moving so quickly, and that there are so many new technologies that are coming out regularly, that without some framework to really ensure the privacy and security of data, ensuring that the models themselves are inclusive and equitable, that what is developed can be trustworthy. You want to be able to develop these systems with the goal that they can serve entire populations and serve long term, while being the right fit for the entire population. So I'm excited that at least within the healthcare space and within Canada, there is this very strong emphasis on using these exciting new technologies. Canada very much is a leader in the AI space, but that as we leverage them, we develop them responsibly. To that end, there are a few projects that I wanted to highlight, one of them being Think Rare. It is a GORI project under Dr. Kim Boycott that really is focusing on detecting rare events, rare diseases. The project I want to speak specifically to, and that, as was introduced, was the work on autism spectrum disorder as a relatively rare within the population condition that has a very complex manifestation. We want to develop a system that will try to capture as early as possible cases within the system, with the goal underlying all of this that instead of having a healthcare system that is reactive, to have one that is proactive, that would recommend to individuals whether additional screening or follow up with a physician is required. That said, underpinning all of this work are the real pillars to the AI research work that we're doing. We really want to expand the capacity in each of these four research focus areas. Born itself is moving in the direction of becoming an interventional prescribed registry, the goal being to deliver near real-time accurate and authoritative insights, both to patients and clinicians. And so of these focus areas, I've worked considerably in the area of rare event detection, really to find those edge cases of different individuals with certain conditions that are considered rare within the population. And so this was largely built on work that I had done as part of my PhD research work. But I've taken also this particular interest in explainable AI. So we know most AI systems to be black box models. They're developed on large scale data systems. But if you ask most machine learning researchers, how does it actually work? What does it actually do? Most of the time, it's a very complex answer to get to the point of we don't really know. And so there's this emergent field, explainable AI or XAI, that seeks to try to peer into the box, develop methodologies themselves to try and explain why certain AI models are doing what they, why do they predict what they predict. And so this is an example of images from an ultrasound project on trying to detect renal anomalies. And even though we have a certain classification that would say one ultrasound image versus another may or may not have an anomaly, we want to basically add this layer on top that shows what did the model focus on, or why did it, what was it looking at essentially when devising, its answer. And kind of building on top of that, my research lab tries to develop new methods in the same domain. So we work in what are known as class activation mapping models. It's these mechanisms that try to understand how the model arrives at its certain prediction. And this is just one example project where we used a collection of various different CAM methodologies and combined them together to come up with this ensemble-based CAM-based method. And the goal would be to deploy this and use this as part of all other image-based projects that we are undertaking. Of course, we operate in the PHI domain, so I would say most other developments of AI don't have the same limitations or considerations around the data that they use. And so within the healthcare system within Canada, I think privacy-preserving AI development is of the utmost importance. So when we develop these systems, a lot of the data will be siloed to different organizations. And in a traditional machine learning context, you would normally have to centralize that information together. But without the right data sharing agreements and whatnot, this can prove challenging. And so there's various technologies and approaches that can be used to circumvent some of this. The goal being to try to collect as much of individual health data together to get this really rich representation of a patient's health information and trajectory. This would be combined through different types of information, different modalities. So images coming from ultrasound and tabular data coming from EHRs, and there might be clinicians' notes that might be text. And so multimodal modeling is a new and emergent technique to combine multiple types of data together to create these rich representations of information that might be used for a specific diagnosis. But of course, the sharing of that information must be done in a way that adheres to PHI law and be done in a way that is privacy preserving. So that's our other third pillar. And of course, then we want to bring all these components together and have them applied to the perinatal health domain. And that's where this project on autism spectrum disorder was a bit of a first of its kind within Canada. We had over 1.7 million different mom-baby pairs that we were using basically to generate this large-scale transformer-based machine learning model that we were able to achieve quite impressive levels of performance with. And of course, some of this is still pilot work, and it was exciting to be able to share this with Kevin O'Keefe as part of a previous podcast. It's nice to highlight these examples because I think it's a great way to show what can be done in these spaces and how we can continue building on this current work to bringing this into real world life impact. And so the vision, I would say longer term, very much for the work that we do is towards this fully integrated privacy preserving health AI network. The idea that different information will come from different sources that might be held by different organizations, but shared in a privacy preserving manner that can operate at the population level to create a system that hopefully will provide the right information to the right person, the clinician, as much as the patient over time, and to deliver that information on a near continuous basis. And so the key takeaways, if there's anything that you want to take away from this deluge of information, really the goal that we have is to empower both the patients and the clinicians. Really, we want to move in the direction of enabling evidence-based, timely, and personalized insights at point of care. Of course, much like Sick Kids, GRI, and Born and other organizations, as long as we are developing AI in a very responsible manner, I think that's the kind of impetus that we have behind a lot of our work. It's an exciting technology, but we want to make sure that we have the right frameworks in place to make sure that it's being done safely. And again, the scope that I said, while a lot of this work is being done locally, much like Sick Kids, who is using their work and operating internationally, there's this idea that much of the insights that we develop and the work that we do, while done locally within Ontario, also has a national vision in mind. That through partnerships with other healthcare jurisdictions, there's a lot of opportunity to really take these innovations and have them applied at scale. And then I'll just do a small shameless plug for the academics among us that core R&D funding for these types of research projects really goes a long way to being able to translate the research to the clinic to have a real world impact. I would make the case that Canada is a leader in AI and a national solution even for computing resources that would function for privacy, for PHI data would be something that would be phenomenal to leverage. And so on that note, I just want to wrap up with a few resources, references, and also to acknowledge some of the collaborators who have been instrumental to bringing this work together. And I'm happy to chat with the rest of the folks on where this is all going.
Excellent. And speaking of chats, we have several raised hands, we have tons of questions, and we have 20 minutes left. So what I would like to do now is bring in Azra to do your presentation. And then I promise everybody waiting in the queues, we will get to as many questions as possible. But Azra, I think your element is key to this discussion. And full disclosure, Vector Institute is currently working at ChiHi to help us implement AI. And everyone I talk to, I'm not exaggerating, working in healthcare at some point has mentioned the Vector Institute. So what advice would you give to someone here today, listening, participating as they step into the world of AI?
That's a great question, Kevin. And before I start, I think going last has its benefits, but it also has its challenges because the speakers before me have kind of set the bar so high. So thank you for that. But Robert and Kevin, thanks so much for sharing your organization's innovations. And Alvina, thanks so much for sharing about your story. I think it's really important for us to hear the patient experience as well. So thank you to my colleagues. And so much of what has been embedded in this conversation is about trustworthy and safe AI. And, listening to the first three speakers, what really stands out to me is it isn't the technology, it's about the experience. It's the moments where innovation reduced uncertainty, it supported better decision-making, and it improved care overall for someone like a patient. And I think Alvina said this in her intro, that everything is about people. And it's true. These stories remind us that AI only works when it works for people, and outcomes like this don't happen by accident. They happen by intentional choices. And so I'd like to spend the next few minutes just talking about why responsible AI is fundamental and why it matters for anyone who's building or adopting these types of solutions. And at Vector, we really think of responsible AI not as a separate work stream, but as part of how innovation really succeeds in the world. So if we go to the next slide, I'd like to actually ask the audience that, responsible AI means different things depending on where you sit. For some people, it's about safety. For some people, it's about bias. For others, it's about trust, transparency, and the diversity of those perspectives is actually the point, is that responsible AI isn't owned by technologists alone. So maybe we'll just take 20 to 30 seconds or so, and if you can drop your responses in the chat about what do you think responsible AI really means to you? I see a couple coming in: trust and safety, reliable privacy. Yes, all excellent. Equity, privacy. I'm reading all of these responses, and all of them are bang on, very true. And if we go to the next slide, I can share that at Vector, we've defined responsible AI as an approach to really developing, deploying, and maintaining AI systems in a safe, trustworthy, and ethical way. And what I'll share is that, this spans the entire life cycle of a solution. It's not just model development, but deployment. We talked about monitoring being, paramount to these solutions and its ongoing use. So in a high stakes domain like healthcare, responsible design upfront really prevents downstream harm. And in the next slide, what we've shared is Vector's AI trust and safety principles. So we really ground our focus on responsible AI in 6 trust and safety principles. And that is that they should benefit people and planet. AI should respect democratic values and human rights. And it should balance privacy and security of individuals. It should remain robust, secure, and safe over time. So to what we heard earlier about ongoing monitoring of its use, is it performing in the way that it is intended to? Oversight should include responsible disclosure, and organizations should remain accountable. So really to those last two is that we're all very curious people. So we want to know, how a solution works and why the output is the way that it is. And I know Kevin kind of spoke to that in his discussion as well. And then, of course, being accountable to the laws and the rules and the legislation, that is out there governing AI. And so in the next slide, we talk about the human element of AI. And responsible AI really starts with human needs, with lived experience, as we've heard from Alvina, and real world constraints, as we've heard from, the innovations that are happening at the hospitals. And so our approach to building responsible AI systems is really putting people first. And so what I want to do, and what we do at Vector, is really encouraging our community to shift the mindset from technology first to human first design. So instead of approaching a problem of how can we use AI to solve this, moving towards how might we solve such and such a problem, and then to then, how can AI solve this problem in a really unique way? And this revised how might we statement really focuses on the problem itself. And so if we go to the next slide, when we're building models, we need to ask the questions that matter. Are we building something that's good for the world? Do we need to use AI when we're trying to solve these problems? How realistic is our solution? What are the success metrics? How do we know that we have succeeded in what we're trying to achieve? And how might our AI product fail? And these questions really help to reduce risk and increase adoption. And the best way that I can showcase this is in a case study in the next slide, where the Vector Institute was working with Kids Help Phone on a problem that they brought. And this is a really strong example of a human-first responsible AI in practice. But for anybody who isn't familiar, Kids Help Phone, it's a charitable organization which has a chat app that provides crisis response and crisis support to young people across Canada by connecting them with trained volunteers who are counselors. And over the last 5 years, you'll see it on the next slide in the metrics, nearly 8,000 counselors have had a total of 700,000 conversations with 340,000 young people. And I actually, now that I'm thinking of it, I was at a conference a couple of months ago, and somebody from KHP took the stage, and I think these stats are outdated. I think they're actually higher now, but it really does show the magnitude of the number of folks that are reaching out for support. And so when we, were speaking with KHP and they came to us with this problem that they wanted to solve, if we can go to the next slide, please. Their how might we statement was, how might we increase the capacity and morale of our volunteer counselors? And what we've identified was what the user needs were, doing the research to find out young people really want to express themselves using their own words. So language was important. Counselors wanted to be able to predict and support youth needs without clinical training. And they wanted to spend less time on administrative tasks. And so, Kids Helpful wondered how AI could help address their problem. Youth wanting to be able to express themselves in their own words, counselors wanting better insight and really less administrative burden. And so together, our organizations brainstormed some solutions, and we landed on using AI to really identify issues that youth share in conversation with the counselor using their own vocabulary of words. And the way in which the solution works is counselors can use AI-generated issues to fill post-conversation surveys more efficiently without replacing their clinical expertise or decision-making abilities. And so these post-conversation surveys really gave us insight into the issues that today's youth are facing, which then allows staff to be able to provide them with better support. And so, the AI helped to identify themes without replacing clinical judgment. And the balance of all of this is responsible AI in action. And what this example shows is that responsible AI isn't theoretical, it's operational. And the trust and safety principles that we talked about earlier really show up here in a very practical way. Human oversight remains central. AI augmented rather than replacing any expertise. Privacy, safety, accountability were designed in this type of a solution from the start. And so this is a good example of human-first AI, especially when it's done well to serve patients. And so maybe what I'll end off with saying is that we all have a role. Developers shape what's possible, but adopters shape about how our systems are used, how they're governed, and how they're scaled. And so I think I'll pause there, and I think hopefully we have some time for some questions.
Yes, we do. And thank you, all the panelists. I feel like we just squeezed so much content into 50 minutes. And I think we have to do another webinar on this. But I really, really, really want to get to some questions. Everybody has been very patiently waiting. Hasna, go ahead, ask your question to any of our panelists.
Thank you so much for providing me the opportunity. The webinar is really very informative, and thank you for providing such important information. So my question is, are there any accredited professional AI training programs available in Canada?
That's a great question. I'll just quickly plug CaiHi. CaiHi has a bunch of programs, not accredited, but about AI. But go ahead if any of our panelists want to answer that question. I'll let you go first, Asra.
Yeah, I know that TCARM actually has an accredited program, a certificate program in health AI. I believe there's one for healthcare professionals, and I also believe that there's one for the general public. But I'll search for the link and drop it in the chat right now.
Angela, you have been patiently standing by with tons of questions, 29 questions. Go ahead, see how many you can get in, please.
So here's a really interesting one. The question is, under the Canadian law, if an AI diagnostic tool makes a mistake, is the legal responsibility held by the attending physician, the hospital, or the software developer?
Well, that is a good question. Anybody want to tackle that?
I could start, and I'm certainly not a definitive voice on it. And I guess I would say do your own research. This is a very evolving space. There has, from what I understand, there has not been any litigation that has happened in this case yet. So the precedent has yet to be set. Most of the medical bodies, I believe the Canadian Medical Association, puts the liability of using the tools. If it's a clinician-facing tool and they use it, they would take responsibility for the output of it. The reality is, though, in the event of something going wrong and there's a lawsuit, likely the hospital would be named as well in the lawsuit. I know we're taking a lot of measures when we look at responsibly deploying things or deploying things, that we identify risks associated with the tool and do sort of risk-benefit analysis before we make a decision to turn a specific tool on. I also know it's an evolving space within the Canadian nursing oversight body as well. They've had some papers come out recently on the topic. I'm not super familiar with the details.
Excellent. And sorry to move people along. I know, Robin, you have a question. Go ahead and ask your question, please. Thank you.
I'm curious, a lot of you have spoken about clinicians working with AI. And in the fall, there was that study out of the Lancet that found that using AI made doctors less skilled at spotting cancer. So I'm wondering how we balance using it regularly with keeping our skills up as the humans in the loop, and what you're thinking about that.
I was just typing a response about keeping the human in the loop, so maybe I can go first.
Please.
But it was towards another question, which was related to AI chatbots, which is being used maybe not just by physicians, but just in general. I think that a lot of what's being asked in the chat and about the human in the loop, a lot of this is valid concerns and really underscores why things like chatbots and some of these other solutions can't function as standalone, and especially for decision making. And it really emphasizes this whole keeping the human in the loop. And when we talk about responsible deployment, it really requires clear guardrails, defining use cases, escalation pathways to qualified clinicians, and real-time risk detections. So I think that it's really important, and obviously is still fundamental in terms of I talked about augmenting rather than replacing. This component of keeping the human in the loop in clinical judgment is still extremely important.
Yeah, and I think I'd also just jump in. I think there's a big importance that needs to be placed on education. When we think through how AI is going to transform society and so on and so forth. When we think of the Lancet article, it's a very specific case to healthcare on physicians using the tool to their end. But I think the underlying issue or the underlying process that we're going through as a society is, how do we integrate AI generally with our own experiences? What will this mean as critical thinkers within society if we're just offloading a lot of our own critical thinking to a machine that more or less may or may not get it correctly. What does that mean for our own, capacity to engage meaningfully in our work? And I think that translates more to education when we think about how do we want to, as a society, move to the adoption of AI in various fields. What are the ramifications and impact on our own critical thinking, our own ways of engaging in work? And so I can imagine stories or examples like this article are just one to think through. How do we want to meaningfully integrate them within workflows and still have checks and balances on accurate work being done? As much as they make us faster, I think there's going to be this transition period in adapting to an AI augmented society. So,
I always refer back to cars. When cars first came out. And I keep saying this all the time because I'm like, hey, if you think of how we dealt with transportation in the beginning, there weren't any paved roads, there weren't any seatbelts, there weren't any airbags, red light, there were no rules. But we built the rules. And not only did we build rules, we now have, I would call a 3-party kind of mutual agreement. So there's society and governance that decided rules that those who make cars and those who drive cars have to respect for safety. And so each of us has responsibility. So there's responsibility on the user end, but there's responsibility on the manufacturer's end, and there's responsibility on the governing end. So a manufacturer must create opportunity for safe use. They must have a seatbelt, but then I, as a user, must wear my seatbelt, right? So I think we're coming to this place of conversation of how to create this, this model where there's shared responsibility and overall there's governance. So do we need a ministry of AI with the full-on, just like how we have ministries of transportation? So maybe that's the question that we're going to be answering, I don't know, next year.
That's a great way to end, because I want to apologize. There's so many questions and raised hands, but we're down to the last minute. So let's do this again. Maybe not even next year. Maybe let's do it later this year. I really apologize. We couldn't get to very many people today, but we are just sort of out of time. And I really want to thank our panelists for a terrific discussion today. And of course, everyone who came out and those who got their question in. If you felt inspired to learn more about AI and healthcare, CAIHI has partnered with the University of Waterloo to create several e-learning courses free to Canadians. All the information is at caihi.ca, or you can stand by for a QR code linking to them in 1 minute. We welcome any feedback and suggestions for future webinars. Easiest way to reach us is at beyondthenumbers@caihi.ca. Also, within a week, you'll be receiving an email with a recording of today's webinar and a link to register for our next webinar. We will be back on Thursday, March 5th with Gray Tsunami or Golden Opportunity, Long-Term Care in Canada. CAIHI will be releasing a wealth of information on long-term care. We'll have a team of experts standing by to help explain what those numbers mean. Now, get your phones ready, because we leave you with QR codes for Alvina's podcast, the podcast Kevin Dick was involved in, CAIHI's AI courses, and a link to register for our next webinar. We hope you'll join us on March 5th.